Welcome everybody out again. This is several times this week I've had a chance to talk to folks about Qivana, and this is another good night to be able to do this and to share with you some experiences personally that I have from the business side, and also some experiences that I have as a physician, because I have the absolute pleasure to be able to share products with not only friends and family and people that I've come to know, but also a large number of patients that I have in my medical practice that I, over a period of time, decided I could not withhold from them any longer such phenomenal products. And this took me about 6 months to be able to accept, because I was introduced to Qivana in April, and since April it took me about 6 months before I would involve the first patient in it, because I just didn't feel comfortable. But all of a sudden I began to feel bad, like I was holding back something from people that needed it so desperately. And I have never regretted the change that I made, where I actually said for the first time, I'm going to share this product with my patients, but because I don't think ethically I can hold that back any longer, and I've never regretted that since. I have 68 patients at this time that are presently taking Qivana's metabolic system, and you're going to hear about that later in my discussion tonight. But it is 68 people who are on a metabolic system that has changed their lives dramatically. I've got 12 diabetics, and of those 12 diabetics, every one of those 12 that I'm mentioning, I have more than diabetics and 12 that are on the program, but I have 12 diabetics that have stopped all of their diabetic medications. 4 of those patients had oral diabetic medications, and another 3 of those patients had oral diabetic medications and insulin, and have been off their insulin and the oral diabetic medications completely over a period of 3 to 4 weeks. And that's quite phenomenal. It's something I've never seen in 34 years of being a physician. I have seen people make some dramatic changes. And most of you know about wellness and weight management, that most people that get on a wellness and weight management program last for a few months. They go through about a 3-month cycle, and then they're back again, aren't they? It's a yo-yo thing, and I'm beginning to wonder if it's not part of the business strategy for most of the companies, and maybe that's Slim Fast and OptiFast and MetaFast and this fast and that fast. Maybe part of the program is that they expect you to have to restart again in 3 months. Maybe that has some financial significance, I don't know. But my goal, and your goal should be, because you're going to surround yourself with people that you what? Love and care about, people that you have a relationship with, people that trust you and that trust your word. And you're going to be exposing these people to some fantastic natural products and perhaps a phenomenal business opportunity. And you want that to be real, don't you? You want it to be persistent. You want it to have longevity. You want to be able to go back to it later and perhaps see that you've been successful. And that's what this is all about, because I think for the first time you're going to have the opportunity to positively affect the lives of people that you care about and love. And what could be greater? What simply could be greater than to be able to touch somebody's life and perhaps save their life? I don't know, if you took the first 100 people out of Walmart, and this is a favorite thought process, and you look at them and you're thinking, yeah, that 70% of that bunch needs to be on the Qivana's metabolic weight management system and lifestyle change, don't you think? Probably we would be pretty successful in saying that. But suppose that you were able to take that first 100 people out and maybe get them on the metabolic system, perhaps even do better than that. Get them on the core system to prepare their bodies and stabilize and vitalize and optimize the function of their intestines, so that at some later date, after being on both programs, a metabolic program as well, they have lost weight and perhaps kept that weight off for 5 years. What do you think would happen to their risk for having heart disease? What do you think would happen to the diabetics? What do you think would happen to the patients that had elevated cholesterol? What do you think about the patients that had degenerative arthritis, that were carrying around a backpack weighing 40 or 50 or 60 or 70 or 80 pounds, and they didn't have to carry that backpack? What about their longevity? What about their chances for living 10 years longer? What you're going to find, just as we see in most studies that we do medically, if we can make those changes, we can actually see people's lives saved. And I always tell this, and I'm going to share it with you again tonight. And how many of those lives would you have to save before you felt it was a real worthwhile experience? Of course, everybody knows the answer to that, just one, right? If you could positively influence the lives of so many people and help them through this process, you're going to have that experience, and you're going to be able to look it in the face, and you're going to say to them in your mind, you're going to say in your mind, I helped save that person's life. And I've been doing this for 34 years as a physician, and I can promise you, no other experience you're going to have in life is going to give you that kind of feedback. There's nothing else out there that will give you that kind of pleasure, and that's what keeps physicians moving on in difficult times and fighting the problems that they have to fight in this day and time, is the chance that you have to positively alter somebody's life. And I'm going to share that with you tonight because we're going to talk about products, not one, but 5 different products that are going to give you the chance to alter people's lives. For the first time, now I've been in Qivana since April, and for the first time in my experience as a doctor in 34 years, and I have seen a lot of products come and go, I have never seen a natural product company that has used scientific validation as the basis for presenting new products for human use. Derek Hall, who is the CEO of Qivana, is probably got the most managed experience that anybody could ever have in this country to be involved in network marketing. But surprisingly, in spite of his leadership skills and his amazing management skills and the ability to take companies internationally, he is most known for his role and leadership role in guiding the natural product industry towards using only products whose medical benefits have been based on scientific validation. That means test tube trials and animal trials and human clinical trials before products are introduced to the public. He is the father of this concept. He is the person that helped generate enough pressure within the natural product industry to make it almost embarrassing for a company to introduce products that didn't have some degree of scientific validity. Qivana is the first company to ever do that. And to start with in the company, they decided that they were going to approach healthcare from the center part of the body, that they were not going to attack a specific disease entity, that they were going to start on something that had a general health benefit so that they could affect so many different systems to start off with. And they were going to do that through the core system of the human body, starting off with the intestine and providing what we need to make our body work and function more efficiently. Now, to start off with, everybody's heard the word of probiotics. You know what a probiotic is by now? Probiotics are nothing more than live, friendly germs that we want to give back to the human body to replace dead and dying germs that have been killed through environmental exposure of one thing or another. And that could be anything from your doctor's prescription for an antibiotic for a urinary tract infection or pneumonia or bronchitis, or it could be the chlorinated drinking water that you've been drinking for years, or the foods and processed foods that you get from chlorinated drinking water that has been used in the processing of foods. Maybe it's alcohol you drink at night. Maybe it's the toxins that you take in your body. Maybe it's just the aging process. But we do know that that ratio of good germs to bad germs in your intestine that you start off with at birth has a specific and very special function in the human body to help protect your intestine and your body against the insult of diseases. And that could be anything from cancer to exposure of toxic chemicals, and it could be allergens that you are exposed to from outside of your body. Because did you know, by the way, that 80% of the immune cells in the human body reside in the lining of the intestine? Did you know that? They're called Peyer's patches, little special spots in the intestine that house these amazing groups of lymph tissue that help your body respond to the different insults in life. And that may be an infectious insult, or it may be cancer, it may be an allergen or something that you're exposed to. So we start off knowing that if we've got all these live friendly germs, about 3.5 pounds of them, if we've got all these live friendly germs inside your intestine and they're being killed off, we know that what happens to the ratio of good germs and bad germs in the intestine is it becomes reversed. If you reverse that ratio, then you begin to expose the body to risk. Because when we now have live germs that are bad germs, such as E. coli and Clostridium difficile and Salmonella and all these bad germs that we doctors hear about all the time, if there are so many of them in the intestine and they lie close to the walls of the intestine, they can very easily establish themselves in the walls of the intestine or pass through the intestinal tract into the outside part of your body where they can establish themselves and cause infection. What we want to do is we want to replace those live germs. Is that an easy process? Not really. It's not an easy process because we know that the body has some defense mechanisms, doesn't it? It has got a stomach acid environment that will kill almost any germs that touches it very quickly. And we also know that there are other defense mechanisms in the body. And so to be able to give you a live friendly germ that is going to pass through your intestine and dissolve somewhere in the small intestine and inhabit your large intestine is a very complex process. To be able to do that, we've got to have something that will pass all these defense mechanisms. There's 900 products